Hi, Dr. Shelley Bole. My name is Olubumi Salami. I reside in Bowie, Maryland, and I'm currently enrolled in DMP, M, DMP PMHMP. It's a long one. So this is I'm going for my second year currently. So today I'll be talking about nursing practitioner and the difference between nurse practitioner and physician assistant. What is nurse practitioner? Nurse practitioners are registered nurses licensed to interpret diagnostic tests, diagnose, prescribe, and order medications, as well as perform some clinical procedures within their scope. MPs are clinicians that blend clinical experts in diagnose and treat of on and treatments of different health conditions and emphasize health management and disease preventions. According to American Associations of Nurse Practitioners, MPs also complete a doctoral or master degree program and must have advanced clinical training. MP offers service to patients across communities, group, family, and lifespan. They concentrate on disease prevention, chronic illness management, and health promotions. MP specialize in different areas, including mental health, women health, pediatrics, and geriatric, according to Yang in 2018. And of course, mental health psychiatric is my specialty. How does a nurse practitioner differ from a physician assistant? The difference between the nurse practitioners and the physician assistant starts with the form of education they both receive. The education for a PA is drawn from the medical model, while, of course, of an MP is drawn from nursing tradition, which comprises of wellness approach and a whole person, which is um, uh, the whole person, holy treatments. Another difference is in the scope of their practice. MPs are offered specialized care to special group and emphasize preventive care and health promotion. The PA concentrates on assessing and as well as the PAs concentrate on assessments and diagnosing and treating the various diseases. The group, the groups, the two groups also differ based on the approach to patients and medical care. Nurse practitioners often take a nursing approach to medical, and patients are to medical care, while the physician assistants offer care through diseases preventions and management using a medical model. Beside, MP focus um, on a given patient population, such as children, women, and while PAs focus on a specific medical field, for instance, dermatology, orthopedic, by Kutzman and Bolno 2017. How does a nurse practitioner differ from a physician continues? While the nurse practitioners and physicians share a lot of responsibilities, for instance, diagnosing or treatment and prevent prescriptions of medications, there are numerous differences between them. Physicians are scientists focused on the studies of disease and how to treat them, while MPs are healers and focus on care of the whole body, holistic, and mind wellness. The period of attaining education and training in the two fields differ, since physicians may take about 12 years, while MPs may require only 8 or fewer years of training. The specialization of MP is often broader compared to that of physicians. Physicians go through general practice, but mostly specialize in different fields such as cardiovascular surgery, or on the other hand, NPs specialize in fields such as women and children health. Therefore, physicians are highly specialized compared to NPs by Morgan 2015. Why don't you become a physician? Great question. Why transitioning from a nurse to a physician is possible? It will require patience, time, and commitment, since one will be needed to start from the medical school and pursue a bachelor degree program in medicine, and as well as complete residency. It will require a lot of time, resources, yet one could become a nurse practitioner and do what physician can do, although in a limited manner. In this view, it is easier to transit from a registered nurse to a nurse practitioner, a field that will give one the ability to diagnose, access, and assess, and also prescribe medication, just like a doctor. A nurse becoming a doctor will be challenging, will be challenging one, since the nurse course is majorly based on the traditional nursing approach as opposed to medical approach. Nurse learn how to be healer through focusing on the body mind wellness, which is different from the physician. Thus, they need to start medical school from the scratch. With these few illustration, I hope you're able to enjoy my understanding of a nurse practitioner and also a PE. Thank you so much for watching. Have a good day.